What is going on, Walk-ins Welcome family? We're back with another interview, another episode. We're glad to have you. We're going to be having a conversation with a friend of ours that we met at the last Southeastern Regional Urgent Care Association, SARUCA, for the uninitiated,
the UCA'S.
with the CEO of the Urgent Care Association, Steve Sellars. But before we get started, the reason we want to bring excellent people like Steve on this podcast is so that we can help you get more patients, deliver better care, get repeat visits, scale your clinics. That's what we're here for. Michael, what's up, brother?
Glad to be back in here. We are right now recording in mid-February. We're in a warm snap right now, and where we are, so it feels really good outside. But you know, we're halfway done with Q1 already, which is bizarre to me. But here we are, and we were looking at our schedules earlier, and we are travel packed for the next 2 months. So we will seeing some of our audience members in the next 2 months for sure.
And one of them will be at the UCA conference.
Absolutely. So, but who we have today? So I bet people know this name. So it's Steve Sellars. He is the CEO of the Urgent Care Association, which is super awesome. Makes us feel really good that he wanted to come talk to us.
Absolutely.
So, but he's been in the healthcare space for 30 plus years. He's been in the urgent care space for 20 plus years. And he was also the UCA board president from 2016 to 2017. So it is safe to say he lives and breathes urgent care. He has seen it all. And so we're happy to have him on today.
Steve, welcome to the podcast. Say hello to the Walk-ins Welcome family and tell us one thing about you that nobody else knows.
Thanks for having me, guys. Glad to be here. Something about me that people may be surprised to learn. I'm a grandfather. So my son and his wife have 2 kids, a 4-year-old granddaughter, and I have a 1-year-old grandson. I know it's hard to believe based on how young I look, but that was a joke. No, just at a awesome phase or stage in life that my wife and I are having a lot of fun with right now.
You'll have to correct me if I'm wrong, but I've heard it say that grandkids are the gift you get for not killing your children.
They're way better than kids, man.
That's what I've heard. I'm not in a hurry to get there, but I will look forward to it when it happens.
I mean, I guess maybe next 10 years.
Stop it. I'm not ready. We'll see. We'll see. Kick us off, Michael.
Yeah. So, Steve, obviously your career in urgent care is probably one of the most seasoned ones we've ever talked to. I mean,
sure.
If I had to take a guess. And so I know people want to know, like, how did you get into this? What kind of path were you taking? And you've hung on to this industry for 20, 30 years. And now you're at the top tier from the standpoint of people are going to be listening to what you say. So how did you get there? How did this all come about?
Yeah. So look, I'm fortunate to follow in the footsteps of, some people that you guys know well, Llewellyn and Laurel. And, I think, they both built a strong foundation for UCA. I'm also, have to say I'm incredibly proud of the team that we have and the countless volunteers that partner with us. And our work happens because of their commitment to the industry. And so, I'm very honored to be in this role. Prior to joining UCA, I spent about 20 years as the CEO of a multi-state health system urgent care joint venture partnership company. So as you said, I've lived the operator side of this business, the good, the bad, and the very ugly. And so, I was in the trenches with site selection and staffing challenges, payer negotiations, marketing decisions, partnerships with health systems, and everything in between. And, I think that experience really shapes how I think about my role today. Prior to my time in urgent care, I spent 5 years with a large health system. So I was on the provider side, but with a big health system. And I represented the health system in all of its managed care negotiations, all of its payer relations matters. And it was there where I was really exposed to every aspect of the provider side. So inpatient, outpatient, physician practices, new practice startups, ancillary services, and joint ventures. And that's, the joint venture side of it is where I was introduced to the founding physicians of the company that I I was with most previously. So spent 5 years on the health system side, and then right out of college, LSU, go Tigers, by the way, had to throw that in for you guys.
We'll talk about LSU here in a minute. I want to know what your thoughts are on some things.
So I spent, prior to my time on the health system side, I spent about 7 years on the payer side, working for a couple of different health plans. And there I was responsible for developing provider networks, which basically means contracting with hospitals and physicians and ancillary providers. So learned a lot about payment methodologies, fee for service, full risk, global capitated contracts. Learned a lot about that. Learned a lot on the payer side in my time there. But I think more importantly, I learned that being on the payer side really wasn't for me long term. But that being said, it was an experience that was great for me and one I wouldn't trade today. So I guess as far as background, I sort of have a unique healthcare administration background. I spent 7 years on the payer side right out of college, followed by 5 years with a big health system, and then the last 20 years in urgent care.
So, Steve, you're bringing multifaceted approach to medical, to healthcare, specifically taking these experiences to urgent care. And now you're steering the ship for the Urgent Care Association as the CEO. So I want to dig immediately into the upcoming conference that's coming in Chicago. I want to talk about it. And I want you to give us a high level of what the urgent cares can expect that are going to attend. But what I really want to talk about is, with you being new to the role, this is your first time being in the leadership role that you're in for the conference. What can we expect that's going to be different than it's been there before?
Yeah, no, great question. I think I'll start by saying, I feel like my job, this role that I'm in, is really to strengthen the entire urgent care ecosystem. Okay, and to make sure operators have a strong national voice or a seat at the table when major healthcare decisions are being made. And so with that, we do have our annual convention coming up in April in Chicago. I truly think it's going to be a can't miss type of an event. You guys have probably seen our theme this year is Amplify. Mm-hmm. And that's intentional. We put together a great agenda, great speakers, focused on helping operators, improve their performance, operating performance, their financial performance, improving the patient experience. There's clinical quality content. And obviously, we'll talk a lot about our advocacy work that we're doing. So, over the 4 days or so, there's going to be a lot of practical sessions on operations and marketing and growth. We're going to do some deep dives into, reimbursement and clinical and compliance, benchmarking insights, things like that. I think, one of the things that I like to focus on with these conventions, it's kind of the reason I got involved with UCA years ago, the networking, the opportunity to be around other operators, other leaders from around the country. Those conversations, whether they're, coordinated or hallway conversations, they're invaluable. So you're in a room with people, or you're at an event with people who understand exactly what's going on, what you're going through. And so I think, for me, that's always been, worth my time and investment. That's why I got involved with UCA years ago. We're also going to have some breakout meetings or sessions. Our strategic advisory group meeting will take place there. We're going to have our foundation celebration meeting or event, I should say, on Monday evening while there. That's always an exciting event, a lot of fun. And, there'll be other networking opportunities as well. So just the opportunity to network, connect with vendors, connect with other partners who can help solve problems. is big for us. And it doesn't matter if you're an independent operator, if you're a part of a health system, part of a large chain, or a small operator. I think this event will have things for you, and you'll leave with concrete ideas that you can implement immediately. Look, I've been to a lot of these conferences, and I can honestly say, this is the thing that I've always looked forward to most each year.
Right. Well, and I get to be a speaker as well, so I'm excited. I get to talk on. It's so funny because we're in marketing, and people don't like to listen to marketing talks very often. Let's be honest; they feel like they're being pitched. So my talk is all about using culture to help have staff retention, because retention is a big issue. Trying to keep people on your clinic side, and I think people forget about culture. Right. And the importance of it and how it can drive that. But anyway, yeah, I'm excited to be there. I'm excited to be in Chicago. I've never really been, to my knowledge. I can't remember if I've been or not, so I'm excited to go.
I'll be there exactly 1 month before you. So.
Yeah.
So Steve, you unpacked a whole lot of things there.
Yes.
Right?
Yeah.
One of the things that is interesting to me, and maybe you could speak to the audience, we have predominantly, if not exclusively, an urgent care audience. I want to go to the vendor side of things. How should they interact with and approach the vendors at this conference?
Yeah, I think about how our attendees should do that. I think oftentimes, look, I look at our vendors as partners in what we're trying to do, and whether you're a operator member or a vendor member, they're partners. And so one of the things that we're really focused on, we've got like 3 big priorities. Okay, advocacy, member value and engagement, and long-term sustainability. Okay, that's kind of our big focus. But interacting with the vendors has always been one of my favorite things as an operator in my days as an operator. Oftentimes vendors can help solve a lot of the problems that you're having as an operator. They're offer innovative solutions to becoming more efficient, and so for me, learning from the vendors has always been valuable when I attend. I know we'll have obviously have a lot of dedicated time to visit with vendors, but and I think we're expecting another sold out exhibit hall this year, which is great. So not sure if I'm touching on anything in particular. Feel free to
No, you're doing just fine. I was just curious, like what y'all try and build. Here's what I know: you have the breakout sessions, and a lot of value is gained through those breakout sessions. There's voting that goes on for leadership, but there's always a divide, properly so. I get that.
Yep.
But y'all do a really good job of creating an environment where it's safe to come in there, eat some food, which is always outstanding.
We always like it when the buffet's in front of our booth.
Yes.
I like to eat. I care about the food. I like to eat.
Yeah, so do I.
I mean, that food at Saruka event was
the best.
That was probably the best food.
It was in New Orleans. I mean, what do you?
There you go. That's what you expect.
Yeah.
I want to switch gears. Let's talk advocacy, because I know
let me. Can I make one other comment?
Oh, would love to.
Yeah. So look, so from my perspective, our vendors, they're partners to us. Okay. And I'll take the advocacy work that I just came from last week in Washington. We had a few vendor partners there with us. And so, when I talk about we're really focused heavily on advocacy and member value and engagement and long-term sustainability, the vendor part of that is, their involvement is just as critical as an operator member to me. So that's how I approach that.
I love what you just said. You don't know this, but it perfectly sets up this segue. So, and what happened? We have a team member, Hannah,
who you've probably met.
You've probably met Hannah,
I know
right?
Hannah.
Hannah, we were having a fist pump party here in the office. Was it Monday or Tuesday? Tuesday, I think.
Tuesday.
Because she has been doing local in the state of Alabama advocacy on behalf of urgent care centers to get legislation passed. And they were able, and by the way, she is at the forefront of this. She is not sitting in the back. Yeah. She's calling the representatives. She's getting the bills drawn up. She's getting the vote along with other people. She's not doing it by herself. And they just got the House bill passed. Now it's going to go to Senate.
I think next week, maybe.
Next week. Yeah. And it's 100% for the benefit of urgent care, not the vendor, not us, but our urgent care.
But I was going to say, in addition to that, was she got connected to the UC advocacy group,
correct,
to get her in the right path, because she didn't know. She's like, how do I even start this? And then she started having conversations with Kristen, and it's like, well, we can get you involved.
Awesome.
And Kristen's awesome. And she's like, I get you involved here. And then Hannah's like, what can we do for Alabama now? And then she saw this random bill and like, yeah, this thing hasn't been passed for a couple of years. We don't know why. And Hannah's like, well, I'll figure it out. And she did. And then now it's passed on one piece, and they got to go pass in the Senate. And it's actually just a reference is, I don't remember the bill number. She'll kill me that I don't remember it, but it's related to allowing, in this state, I think we're the only state left, allowing nurse practitioners to sign off on sports physicals. Up until this very point, a physician has to be there to do all the signing. And so it creates this, even urgent care say, like, this is creating an issue because we can't hire more people to do these sports physicals because we have to hire more, doctors on top of it, not just the nurse practitioners, and it's just expensive. And it was just like, she brought it to the light, and she actually got competing urgent cares to ride in a car down to Montgomery to talk to do the hearing for it.
Right.
And like, they are competing they were competing chief medical officers. Like, they are,
and they're big ones.
They're big ones in this state, and they were in a car together because of Hannah, which is so funny.
That's awesome.
So to bring it back to you, Steve, even the vendors care about the success of the urgent cares outside of just getting the money, and really wanted to connect that dot. With that being said, advocacy is huge for you, and I want to dive into that. You just got back from DC, right? Doing advocacy on Capitol Hill. I'm going to ask you specifically, what were the biggest priorities that the urgent care leaders were advocating for?
Mm-hmm. Yeah, first off, I want to say thank you for, what Hannah is doing. Again, that's partnership there. And what we're trying to do, requires people to kind of raise their hand and say, I can help, or I'm willing to get involved, or what have you. Like right before this call, I had a call with a physician from Texas interested in running for our board election coming up in April. And, here's an urgent care physician that works for an organization that's calling to say, how can I do more? How can I get involved? And that's what it takes, whether it's that or helping with advocacy or any other initiative. I believe, I know you guys believe as well, that urgent care is part of the solution to our access and affordability problems that we have in the country. And, we wouldn't be able to, do what we're doing in terms of telling our value story and creating more knowledge and education around the value we bring to the overall healthcare continuum if we didn't work together. We're stronger together. Okay. So thank you guys for that. When we were in DC, we brought together several leaders from around the country. I think the people that we had there was probably, call it 15 of us, representing about 1,200 centers from around the country. Okay, so we had, representation from small operators, large operators, health system affiliated operators, private equity backed groups, independent groups. So we had great representation, representing well over 1,000 centers around the country. We were there to meet directly with members of Congress and Senate offices. And, we're also engaging directly with CMS officials and some other healthcare policy influencers. So at a high level, from an advocacy standpoint, we're focused on several, I just say, core issues. Payment reform is at the top of the list.
For sure.
Okay. Our goal is to make sure that the people we're meeting with recognize the true value of urgent care. Okay, and so also weaved into that advocacy work is how we can reduce any regulatory barriers. You were talking about signing off on physicals. That's a great example. Limited scope X-ray policy is an example. PA supervision requirements vary across the country, across states. Those are other examples. So we try to weave in things like that, workforce challenges, and just at the end of the day, we want to encourage patients to use the right site of care as well. And I think one of the things that really stood out this year was how receptive lawmakers were. I think there's a growing recognition that emergency departments are overcrowded, primary care access is limited, and urgent care fills a critical gap there. So I think we're making progress. That said, recognition isn't quite enough. And I think, we need policy changes to follow, and that's what we're pushing for right now.
I love that. You guys are solving real issues. That's one of the passion points is we're all here to make healthcare more affordable, better access, right? Get the right people in front of these politicians that can actually influence these outcomes.
I'm curious because you said that it was like urgent care is important. They're recognizing that more and more. Was there anything that when you were explaining like here's the importance of why we're talking to you lawmakers, was there a common question that kind of brought up or like, yeah, this is why we're here, or you didn't realize that was a problem with urgent care? Was there any of that coming around where like this is common sense or common knowledge to an urgent care person, but it was not common knowledge at all to a lawmaker? Any of that came up?
Yeah, I think there's still some confusion or lack of knowledge, lack of appreciation for, what our field or industry does, who we are, what we do, so to speak. Two big things I think is around access and affordability. Like we know our model. We know that 7-day-a-week model, walk-in care, after hours care, evening, weekend care, holiday care. When we start talking about things like that, having access when traditional practices are closed, that resonates well. And then obviously affordability is a big topic in Washington right now. I can't help but think about how broken healthcare is overall, and not to get off on a rant, but this country spends, upwards of $5 trillion a year on healthcare, yet our outcomes aren't necessarily better than other sophisticated countries that spend half as much on healthcare. Okay, and so, I think, I think like in the U.S., you can get the best care in the world, but our healthcare system, the model, is a problem. Okay, and I think there's a power problem in healthcare. We've got 4 payers that make almost $50 billion a year in profits, and I'm not against profits. Okay, I love profitable enterprises, but when you're making that on the backs of employers and frontline healthcare clinicians, something's out of balance there. You look at what's going on with health insurance premiums. They've increased almost 30% in the last 5 years. The prior 10 years, they increased 45%. Worker contributions continue to go up. So we're paying more to pay more. We're paying more in premium to pay more, higher deductibles and so forth. And, all the while, reimbursement to urgent care operators has remained stagnant or even gone down in some cases. So, some things are out of balance there. So that's a kind of a power problem. I think we also have a math problem that plays to our advantage. There's a mismatch between primary care supply and demand.
Yep.
When you look at the primary care workforce, about 25% of primary care physicians are 65 years and older.
Yeah.
Another 22% are between 55 and 64. So you're talking about almost 50% of primary care physicians are 55 and older. And we already have, access to care problems. So the math there, I think we're only producing about 2,000 to 3,000 new primary care physicians a year. We got a math problem there, and we already have, access to affordable care problems. So that's likely to get worse. And, those are the kind of things that matter to us. And I know the value that, urgent care operators provide and how we can help solve some of those problems. So anyway.
Well, let's touch on the primary care, right? Just on the marketing side of things, we are seeing our clinics, they're looking heavily at, hey, can we be a primary care as well? Can we add that to our services?
And then we've worked with primary cares, and it's pretty easy to be successful because, like you said,
they fill up fast.
Like the competition's not there anymore for primary care because they're just not being replaced as they retire out. But the demand is still growing because there was an episode a long time we talked about some of this where like so I'm millennial, and so I'm entering that point of where I understand the value of a primary care, and I used to not to. But as I've gotten older, I'm like, actually, it's really nice to have that doctor to go to get referrals sent out the proper way, and then use the urgent care when I'm just not feeling good. But the primary care is like for larger overarching problems. Because I even had that common experience when I first got my primary care 3 years ago. I can get an appointment the next day. It was super easy. He was new to the area. Nobody knew who he was. It was great. And then I needed him about a month back in December. Next available appointment, mid-January.
Yeah.
I'm like, well, crap. I was like, this is awful. I get the pain now. And he was brand new. And then 2 years later, he was full. So it's a real challenge. And I think, but I recognize that urgent care is that gap filler when it comes to primary care.
Yeah.
Right?
Yeah, I think, even with all the challenges that operators face, I think the fundamental need for urgent care has never been stronger than it is right now. I mean, communities need accessible care, affordable care, and an alternative to overcrowded and expensive emergency rooms. I like to say that, urgent care is the front door to high quality, cost effective, everyday health care. I think, one of the trends that I believe that is going to shape the future for operators is how they're integrated into the broader healthcare system. So some of the things that you were just touching on, I think, urgent care, a lot of operators are providing primary care. Those that aren't are typically a partner to primary care. But I think those that aren't providing, call it traditional primary care, there's a real opportunity to do some primary care light, if you will, identify care gaps, identify chronically ill patients. I think there's a real opportunity there.
Yeah, we even have an urgent care client we've had for years now, and he purposely has he's urgent care first, and then he has 2 slots per day for primary care because he still wants to see primary care.
Right.
So, and it's just, and we recognize too, a primary care patient is more profitable over time because they keep coming. They're supposed to keep coming back.
That's right. That's right. And also the payers, the coding and everything is different. Yep. So I did want to ask the question, why do you think we're not pumping out as many primary care doctors? What's the reasoning behind that?
Well, I think it probably ties back to reimbursement, compensation and reimbursement. I forget the exact statistic. I could put my hands on it, but the number of primary care physicians that they start out in primary care, but let me think for a moment. They don't. How many end up switching to a different specialty? It's a pretty high number. But I think it goes back to reimbursement. There's a lot of frustration around the lack of reimbursement for primary care, for urgent care. I think, that's one of the things that we're really focused on in our advocacy work is, we think reimbursement has to evolve. And, if policymakers and payers want patients to continue to have access to everyday care 7 days a week, after hours, weekends, holidays, at times when they can't get in with another physician, the payment system has to support that. And right now, in most cases, it does not. Yeah. And so I think you can tie that back to primary care in terms of reimbursement there and why we don't have as many people going into primary care.
Okay. So that makes sense to me.
Yeah, it does. So this kind of goes to the question I was going to have. We're second month in 2026, so we still got 10 months left of this year. Is there anything that you're seeing on the horizon in the urgent care space that's coming in 2026 that urgent cares are maybe surprised by, or just some trends that you're starting to see happen? Because, from my viewpoint, we are fully out of COVID era. We're like, COVID is not your driver anymore. It hasn't been.
That's the first time I've heard COVID in like months.
Right.
Just to even bring it up.
COVID it used to be the magic driver for patient volume, and it slowly died off, and it's like off the table almost. Like, it's still there. We still we see patients going through our ads and stuff for COVID related stuff. We see it, but it's just not there. But I'm curious, now we're in 2026. So like that literally is in the past now. And so what are you seeing in 2026 that's coming down the pipeline that urgent care should be ready for, or it's already starting to happen? What kind of trends are out there that you're seeing?
It's a great question. I think of healthcare. I guess maybe let's think about there was pre-COVID, like we talk a lot about that, and urgent care was kind of in a strong growth cycle pre-COVID. Volumes were strong and predictable, and reimbursement, while it might not have been perfect, it was more stable. Maybe we didn't have as many staffing challenges back then. Then you had kind of the COVID era, which was very much a defining moment for urgent care for all the reasons we know. Then kind of today's reality, we're in a different phase today. We're dealing with clinician shortages, higher, labor cost, reimbursement challenges, tighter margins, more competition. I could go on and on. Increased consumer expectations, regulatory issues. All of that leads to higher costs and volume dilution and tough decisions about how to differentiate and so forth. So that's where I kind of think we are today. I'm still very optimistic about the role we play. I talked about the brokenness of healthcare and the power problems I see, the math problems that play into our favor. Some of the things I think about this year and beyond, how do we integrate into the broader healthcare system? I made that comment a moment or two ago. Patient navigation is there's a big need for that. Any of us that are helping our aging parents navigate the healthcare system, there's a need for that. If we're the front door to healthcare, patients come to us, they need follow-up care, they need help with their follow-up care, in terms of who to see, where to go, and what have you. I see a big need there. So integrating within the broader healthcare system. I also think, data and quality matter more now than they ever have. The days of convenience only, I think those days are behind us. I think success going forward is going to be driven by, how we demonstrate quality, how we're positively affecting outcomes, how we're improving outcomes, proving our value, integrating with health systems and integrating with large employers and employer coalitions. I think that's another opportunity and something that's going to be very important to us. But at the end of the day, again, I think reimbursement has to evolve. And that's obviously at the top of our priority list.
I think 100% of our audience would concur with you on that.
Yeah.
For sure.
Yeah.
It looks like you've painted a pretty good picture of what to expect and what to look for in 2026 from the urgent care side of things. I want to give a final call to action to get our listeners to the Urgent Care Association event coming up.
Yep.
Because I know we've been going for, is this our 4th year?
Yeah.
Okay, for 4 years now. And every time we go, we make the best connections. We have the best conversations. It's funny, you'll see some of the people that just not in our industry at all from the marketing side, but just we've made friends with other vendors.
We have friends now.
They'll come hide in our booth and they'll eat with us. And it's just a really fun time. And those connections, there's not an immediate return on investment. I'm not talking financial investment, but there's not an immediate return, but there is a return on that throughout the rest of the year. It really sets up the entire year for success.
Yeah. Oh, I appreciate what you guys do. Again, you guys are partners, and I appreciate you calling out our convention coming up. I'm looking forward to being there. Looking forward to seeing you guys. Look, we exist to help advance this industry. We're here to ensure the long-term, growth and sustainability of urgent care, and I want to call on operators to join forces with us, get involved. There's good reasons to do that. We have a stronger voice. We have a unified and incredible voice when we work together. And there's a lot of practical business value to being involved. I mean, there's the education, the industry insights, the best practices that are there to learn about the networking. We've talked a lot about that. And I think at the end of the day, it's also just about like protecting the future, so being involved matters. I think coming to the convention's a great way to get started with that, and looking forward to seeing you guys there.
Yeah, we're excited to come. We'll have a booth. I'll be speaking. A couple of days. It's going to be fun. And you guys always do a really good party, after party stuff and all different things. You make sure those worn out urgent care people have a good time and can relax for a minute.
Absolutely. Absolutely.
That's right.
And if you're listening to this now, it is not too late to register. We'll drop a link to the registration page in the show notes.
Yep.
If you're on YouTube, it'll be in the YouTube notes down there. We would love to see you there. Drop in the comment section if you're coming. We'd love to hear from you, and we'll be on the lookout for you. Steve Sellars, thank you so much for being on the podcast with us. We're going to do a follow-up. I'm going to go ahead and ask you now, after we have to, even if it's brief, I want to do a follow-up with you. I know the camera just went out. We're still here vocally. We're getting notifications that we're having weird camera issues. But what I wanted to say is we want to make sure that we do a recap after the event.
I'd love to.
You can let us know later if you're like, I'm absolutely not going to do that. But we would love to have you on again if you're open to it.
Hey, let's get it on the calendar. I'd love to do it.
Love it. All right. Well, listen, our camera just went out for absolutely no reason. So I hope you'll listen to this in your car. But listen, Steve, thank you for being on with us. And Walk-Ins Welcome Family, we're grateful for you listening in, and we want to help you grow. Keep tuning in, and we will have more great guests. But right now, y'all have a great week, and we'll catch you next time.
All right. See you guys.
Thanks, guys.